Motion detected at the front door. Someone is at the front door.
All right, now try your microphone.
That's yours, yeah.
Yeah.
But there you go.
Put it up to your mouth.
Okay.
You want to be about you want to be about a fist away.
Okay.
Like you're, blowing somebody.
That would be a long way away, though, wouldn't it?
Well, I mean, if you're getting ready. All right, Scott.
Test 1 2. Test 1 2.
Testing. So the only thing, try to talk just sort of tangential to the mic, or you'll pop your P's. Hear the difference? Look. Okay, so just try to talk a little bit tangential to it. So if you're talking to me with so that you're just to the right of the microphone, and you're talking to the left or vice versa, you'll be fine. Okay. Now, if you're talking like this, that won't work.
Okay.
Because you want to talk across it. And then if you're going to laugh, just turn your head so there's nothing worse than hearing somebody yucking it up right into a microphone. All right?
That'll be my problem.
Okay, no. You'll be fine.
You're going to do super great.
So did you think of a name?
No.
Okay.
So what are we calling her?
Well, Mel B and I named her DJ Jazzy C.
That's a mouthful. That's a
That is
mouthful. I'll never remember it.
All right. So we're live, right? Yep. Okay, people are coming in. So you're in charge of the chat room,
Gotcha.
Scott?
Yes,
okay.
sir. I can handle that part.
Yeah, okay, I know, but you got to pay attention to the show, too.
What?
That's the problem. No, I'm just saying.
Me pay attention?
No.
No.
I don't.
I don't either. Why would I do that?
All right, here we go. Okay, Carissa, your line is poo head.
Poo head.
Here we go.
So far, so good.
I've got diphtheria crushing my esophagus. I've got Ebola vibes dripping from my nose. I've got the leprosy of the heart valve, exacerbating my dreadful woes. I want to take my brain out, blast it with the wave, and ultrasonic angiographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical provider who gives me street cred with the wacko alternative medicine asshats. Hello, Dr. Scott.
Hey, Dr. Steve.
And also in the studio for the first time, we have the woman we dubbed DJ Jazzy C last time because she wasn't here. We don't know what her radio name is yet, but hello, her real name's Carissa. Hello.
Hello, Dr. Steve.
Thanks for being here. This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Take it, Carissa. Poohead.
Poohead.
Visit our website at drsteve.com for podcast, medical news, and stuff. You can buy. I can't mention contractually. Don't tell her that. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right. So what was your one line?
Poohead?
We do that to everybody the first time they're on here, and they never get it. Although I think P.A. Lydia got it because she actually listened to the show, if I remember correctly. Anyway, so our plan is to have P.A. Lydia and DJ Mel B and whatever your radio name is.
How about Super C?
DNP Carissa.
How about Super C?
You know, you're a DNP, right? Well, anyway, we're going to have you guys rotating as third mic. You are a DNP, right? So
Yes.
what is that?
A doctor of nursing practice.
Ooh. So we should be calling you Dr. Carissa then, right?
Nah.
So why don't you guys, okay, so you did your nursing thing, right?
Mm-hmm.
And were you a nurse before you went to NP school?
I was for 6 years.
All right. And then you went to nurse practitioner school,
Yes.
got your NP, and then at some point you got your doctorate, right? I mean, that's what that is, right?
Well, actually, I went straight through from BSN to DNP.
Oh, you did? Okay, so you went straight through.
I did.
And so what's the difference between being a nurse practitioner and an NP and a DNP? You better have a good answer to that.
I mean, right. A lot of research.
More years of school,
More
I'm
years
sure.
of school.
Really? So how many more?
So it was 3 years total for me to do my DNP from BSN.
Okay.
However, the hours were, I want to say 100 more hours at least in clinicals.
Yeah.
So.
Okay, so you did more clinicals, and then you said you had to do some research too. Did you have to publish a paper or do a dissertation or something?
Yeah, they call it a capstone project there. It's not a dissertation. However, it is a research paper that goes through all the processes and then a project that goes along with that.
Okay, so why do this? Why would anybody go through all of this?
All of this torture.
I mean,
all
you
the
don't call
torture.
yourself doctor, so you don't get that out of it. Are you getting paid more?
No.
Okay, so then,
Some people do.
So why?
I wanted to do it personally for the research. I saw a lack of identifying caregivers in the nursing realm. So I went back to school and developed an entire protocol on how to identify caregivers of elderly people.
Oh yeah, is anybody using that?
No.
Well, there you go.
You get nothing. You lose. Good day, sir.
So, well, but still, I'm sure it was very fulfilling for you.
Yes.
Okay,
and
well, that's all that matters.
my chair is still using my paper for future students.
Well, no, that's something. Okay.
I also didn't follow up on it, so.
Yeah, okay. Fair enough. I haven't followed up on anything in my life, so. Check out Dr. Scott's website at simplyherbals.net. Simplyherbals.net. We haven't plugged that in a while.
Nope.
So anything on there? You've got. Oh, wait a minute.
Working on a.
Hey, Carissa, I have ADHD, and I just saw a shiny object. Dr. Scott's got something new, so I'm just bouncing from one topic to the other. Tell us about this thing. This is something exciting. I'm very interested. Did you bring me some?
I was looking in my bag. I think
You son of a bitch. You son
I've
of a
had the
bitch.
longest damn day.
You said
I literally. But what I'm going to do?
You give me the respect that I'm entitled to.
It will be here this afternoon. I literally ran out of my office. So
Well, tell everybody what it is.
Yeah. So what it is? It's our original nasal spray, but now we've put CBD oil in there, and it's
So, how did you do that? Listen, I was going to do something with double vasectomy turd, where I wanted to put Rogaine in a leave-in conditioner, and he had a formula for a leave-in conditioner because he's a master barber and he knows how to. They did some sort of crazy mixology shit in school where he learned how to make different shampoos and lotions and all this kind of stuff. And I wanted to put minoxidil in it and then sell it, as Dr. Steve's hair restorative or something, call it, under the snake oil label or something. And I was told I couldn't do that because they had to be separate. They said we could sell the Rogaine separate and have people put it in if they wanted to, or just do it. And it's like, well, hell, they can just go buy Rogaine. Why would I do that and buy conditioner? So how were you able to just throw CBD in there?
I don't know why he is
maybe. I mean, is
minoxidil a prescription medicine?
No, but it's OTC.
Yeah, well, that's what I thought. Yeah, who told him he couldn't do that?
No, they told me that. So, and if they told him that and he told me that, I wouldn't necessarily believe it. But
yeah.
I mean, I was the one that was pursuing that, and they said they couldn't do it because of some FDA stuff, and that if you took an OTC medication, you couldn't just arbitrarily mix it with something else and then sell it as something else.
I've never run into that. Never run into that. I can because I can actually
because all your stuff is just
bullshit.
malarkey.
Yeah, it's a supplement, Dr. Steve. It's a supplement. It's a supplement. But there was a research a couple weeks ago about CBD oil blocking the receptor sites for COVID-19.
In vitro.
In vitro, right.
That means in the test tube, everybody.
Right. And I have been crystal clear saying there's not been any scientific proof.
Right.
But what we do know is
what's another route for you to get CBD into your body?
Yep.
So where are you getting the pharmaceutical grade CBD from?
It's an organic CBD oil company.
So are they pressing it or are they extracting it? What are they doing?
Pressing.
They're pressing.
Yep.
Okay.
Yep.
So they're pressing it from hemp.
Yep.
And then somehow they're, purifying it by some method.
Some method.
Presumably not
sell it to me for a whole
liquid
bunch of
chromatography.
Money. No liquid chromatography. And when they sell it to me, of course, it's at a much higher price.
Yeah, of course. Now, have you sent the CBD off independently to make sure it doesn't exceed the 0.3% THC in it?
No.
Okay, I would do that.
Yeah.
Spend the extra money just to make absolutely sure, because the last thing you want is for somebody to say, you son of a bitch, I got fired because there was too much THC in my system.
Yeah,
or to get your shit pulled off the shelves by the FDA, because they'll do that too.
Yeah. Well, and we're not there yet.
And I'm not saying I don't trust these people, but I don't trust these people.
No, I'm the same way. I'm the same way, Dr. Steve. No, I'm the same way. There are a lot of steps to go through, and certainly I've been down this road with my simple herbal stuff too, and making sure that we go. It has to be if produced in FDA approved facilities. You can't.
But
make
you can't
any
get fired for peppermint oil, which is what you had in your nasal
exactly
spray,
right.
which made it awesome, by the way.
Yeah, it's the peppermint oil. Peppermint oil is a natural anti-inflammatory.
Yeah.
CBD oil blocks the receptor sites for the COVID. So one would hypothesize
in vitro,
right?
Let's make that clear.
Yeah. And again, I'm not making any statements that we're keeping people from getting COVID. But by spraying it in your nose, because the peppermint oil is an anti-inflammatory.
Yeah.
And other research papers, and I've got them all ready for the website when we put it up. Nasal steroids have been shown to help. Yeah, and they are from what you call it? What's the website like? Oh yeah, PubMed, that little thing.
Oh yeah,
and
good.
But the nasal sprays have been proven to reduce the transmission of COVID through the nasal passage.
What?
Through the nose? Yeah.
What nasal spray? What are you saying?
No, nasal steroid, like
nasal
a
steroid.
Flonase, or or
to prevent transmission.
no, that was a paper, and I've actually got Dr. Steve. I'll pull it
Okay,
up
yeah,
for you.
bring it up. I want to see it.
Yeah, let me pull it up here.
So you're talking about a steroid nasal spray?
Yep. Now, and I do not have steroids in mine.
You're right, of
Mine are
course.
all supplements. A little bit of honey, a little bit of peppermint oil, a little bit of salt, a little bit of baking soda.
So, well, it's a buffered saline.
Yep. And so let me look it up. I've got the
Mine,
website.
I put in steroid nasal spray transmission COVID. Said your search received 0 results.
Oh hell, that's bullshit. You
I
must
know.
you typed
I'm
it in
on
the wrong.
PubMed.
You typed it in the wrong. What the hell's wrong with you? Your fingers have
You know what?
have
Carl from WATP is hilarious. He says, I love it when I get in people's head because every time I am doing research live, I'm like, oh, shit, Carl's going to give me hell for Googling stuff while I'm on my show. Potential role of xylitol plus grapefruit seed extract nasal spray solution in COVID-19, a case series. So
Well, there you
case
go.
series is a collection of anecdotal evidence, but it's a start, and
It's
it's a
a step
place
in our
where
direction, yep.
it's a place where you can say, is this worth doing a double-blind placebo-controlled studies? This is 3 patients. You're not going to get much out of that when you've got 1% people getting severely ill from this. You're not going to get a whole lot with 3 patients. But what they did was they had rapid clinical improvement and shortened time to negativization on the repeat intranasal swab test.
There you go.
So I would say that they're just washing stuff out of their nose, but
Exactly.
that's interesting.
Yep, and that's what we're doing. That's what we're trying to do is not only wash out but block the ability of viruses to, if it does work. And again, we're way from proving any of these things.
Oral rinse with antimicrobial agents is efficacious in reducing viral load in oral fluids. Saline nasal irrigation can reduce viral load in the nasal cavities. This is from the International Journal of Immunopathologic Pharmacology. And so, I mean, that makes sense.
Yeah. Well, and
So
you
just getting people to just
wash out their stupid
just
head.
do it.
Yeah, wash out your stupid head. All
Now,
that crap in
next week we're going to have Martin Hoke from Navage on. How about that? How cool is that? The guy that invented the Navage, and he's going to be on here. And what I'm hoping is we will have a Navage all set up for DJ Mel B, and she was going to do it live on the show. But what I'm concerned about is what if she does it live on the show and then she hates it, and then we've got Martin on there. So I'm thinking maybe we'll do her thing
Risk
next
reward,
week.
big
I know.
boy, risk
That's
reward.
true. That's true.
Hey, so I want to know when he's going to come up with a Navage for the colon, so we can do like our own at-home colon cleanse. Ooh, that'd be nice.
It's called Miralax. Just take that. Anyway.
All right.
Yep.
No.
It's kind of cool. Yeah.
Yeah,
okay.
super
So,
great,
all right,
super
buddy.
great. Yeah.
Well, good luck with that, and bring me some.
Yeah, I'll have you a sample here soon.
A couple of shows back, we had weird codes, ICD-10 codes. Did you bring any, Carissa? I couldn't remember if you were involved in that or not.
I wasn't last time, but I do have one.
Okay, you got one? Okay, give it to us.
What the code actually is.
Oh, yeah. Yeah, do you need to look it up? And I'll give you these, because I'm sort of putting you on the spot on that.
It's fine. I have it.
Okay.
It's sucked into jet engine subsequent encounter.
Subsequent. How do you have a... That is awesome. What's the code? Sucked into jet engine.
Oh, my God.
Subsequent encounter. That means they got
You
sucked
lived
into...
through it.
Right. Somehow you lived through it, or you were just visiting the blood spatter on the
Correct.
on the
Oh,
on the concrete.
God.
That's a good one.
Yeah.
Can you
I don't think I can beat that one.
I mean, so you were sucked into a jet engine, survived, sucked in again, or
No, the subsequent encounter would be the second time you see them. So there's an initial encounter where you just mop up, liquid. And then I don't know why you would ever have a subsequent encounter for
me
somebody
either.
that's sucked into a jet engine.
How bizarre is that?
the patient was obviously Wolverine.
God. Tough son of a
Yeah,
bitch.
Wolverine. Ooh.
Tough son of a bitch. Tougher than I'll ever be.
V97.
Wolverine, so you're a nerd?
I mean, did you not know this?
Well, the audience.
Oh, no. I'm just going to go ahead and intervene. No.
No,
We're
you
not
did
going.
not
We're not
know.
going down this road because if you start letting him nerd out, you're going to see people start falling asleep.
Everything on me right now
No,
is
they're
Star
not.
Wars.
Let me see.
My
Is it?
shoes, my pants, my shirt.
How is your shirt Star Wars? Oh, it's light side. The light side you are.
I am.
All right, that's awesome. Okay, cool. Well, we'll have to when we have matter of fact. Okay, so Pete Davidson's a friend of mine, and I have a friend two friends who have a DC themed podcast called DC On Screen. I'm going to give them a plug. Jason and David are two great guys. They've been on this show before. One of the most fun shows we did is, for me, Scott hated it, was when they came on and asked me comic book movie medical questions. Like they said, could you watch any DC stuff and all?
Mm-hmm.
Okay, so in The Dark Knight Rises, would it be possible for a chiropractor to crack Bruce Wayne's back so that, a spoiler alert, so that he could climb out of the pit and come back to Gotham City to defeat Bane? You remember that scene?
Yeah.
It was a little ridiculous, except I said, I think that he could have, because I don't think that Bane broke his back. I think that Bruce Wayne had a conversion reaction. So when I've had people with conversion reactions before, shut up, Scott. Just let me talk for 1 minute.
No, I'm sorry.
We're going to talk about conversion reactions.
No,
Is that
that's
okay
no,
with
that's
you?
real. Yeah, that's
okay,
real. That's
so
real. That's
anyway,
real.
so
the Wolverine have a conversion?
no, it wasn't Wolverine. It was fucking Batman.
Sorry.
So I've had people with conversion reaction before. I remember a million years ago in medical school having this girl that couldn't walk. And one of the techniques that we used, we said sometimes people just get better on their own, because they were getting ready to threaten with a whole bunch of like lumbar punctures and all this stuff. We said sometimes it just happens. People just get better. And the next day we walked in, she was running around. Yeah, well, I just got better. So we gave her a reason to get better. And so my theory to them was, although, yeah, a pit-based chiropractor who was just cracking on his back probably wouldn't have fixed a spinal fracture, but he absolutely could have fixed a conversion reaction. So anyway,
Fair.
So Pete's a friend of mine, and he actually sort of kind of went on their show and did an interview with them. And why am I telling this story? Oh, because I'm a nerd. Yeah. So anyway, so we're actually hoping, and I haven't asked him yet, but hoping to have him on the Patreon show. So check out our Patreon show, patreon.com/weirdmedicine. And we do sort of some stuff that we can't really do over here, mainly drop lots more F-bombs and stuff because it's behind a paywall. But all right. Anyway, so good to know you're a nerd. Excellent.
Yes.
So Star Wars, Disney, DC, obviously. What else?
Video games.
Yeah. Oh, really?
Yeah.
Such as?
Zelda's my number one.
Okay, I defeated the first one. I haven't.
I've defeated all of them.
The Ocarina of Time or whatever, you defeated that?
Yes.
You went through all those friggin' dungeons and stuff?
All of it.
Oh, my God. Did you map them out as you went?
Yes.
To get
and
through? You have to, right?
I've beat every one of them on regular and hard mode.
Ooh, okay. I'm
I'm
going to have to.
weird.
Oh, no. Wrong one. Sorry. I'll have to give you that. Give you some props on that. Good job. I did defeat Super Mario, was it 2? Or whichever, gosh, I don't even remember which one it was. But
All by yourself?
Yeah, all by myself. And I remember running at the very end. You had to run along this long corridor and picking up coins, and it spelled out, "You are a super player." So if somebody remembers which one that is, that's the one I defeated.
I don't even
But anyway.
know what
I
gaming
just remember
system that was.
It was either the NES or the 64. I think it was the NES, but I remember every time you'd go save the princess, she would say, "Thank you, Mario, but our princess is in another castle." And when you get to
Correct.
the very last one, spoiler alert for a game that came out 30 years ago, you'd go in and finally it was, it's Peach, and she goes, "Thank you, Mario, but our princess is in another." And she, she's like, it's hilarious. It's like I about punched the TV screen when she started to say that shit. Anyway, all right. Thank you for being a nerd. Here's some more codes, but I can't beat the one that you brought. Here's one, and this was from Al. Sent these in, And he said, good day, doctor. On one of your recent shows, you were talking about interesting ICD-10 codes. Here are a few for you to indulge in on the insanity. And one is W34.111D, which is accidental malfunction of paintball gun. Why does it have to have like 7 characters for that? And then W21.19, struck by other bat, comma, racket or club. So I don't know. Anyway. And then Y93.K9, activity involving animal care. Activity involving animal care. So anyway. All right. Okie doke. And then one last thing, and I didn't pick those out. Those were Al, so blame him. This is from Bill Schaefer, and I sent this on to DJ Mel B. Said, I'm finally listening to the show. Thank you from the bottom of my heart. This was the guy that you forgot to say happy birthday to.
Oh, boogers.
And then we did the next week. He said, you guys made my day, and then some. Dr. Scott is forgiven.
Oh, thank God.
And then I asked, remember, we were talking about that baking subreddit. You ever been on the baking subreddit? You bake. That's the other thing that you do. As a matter of fact, if
she's too busy watching.
When they bring back America's, if they bring back the Great American Baking Show, which is with Paul Hollywood, by the way,
I'll win.
I'm going to submit Carissa because she is insanely great at baking and making things look pretty.
Are you really?
Yeah.
Yes.
Oh, that's cool.
So do you know who Sherry Yard is then?
No.
Oh, you looked at me like, of course, but then she said no, so I got mixed signal. So she's the other. She's been named, America's top baker, and she's James Beard, award winner and stuff.
The real deal.
But she's the other co-host, and it would be fun to be on there. And you get to go to England, and they do it there, and you're up against 10 other Americans, or 9 or 11. I don't know the exact number. But we need to do that. But anyway, we were talking about on this baking subreddit that people are posting pictures of cakes, beautiful cakes like you make, with this, insane mirror glaze and all these beautiful piping and all this stuff. And they say, I made this for myself for my birthday. And I just imagine these lonely people being all excited about making this cake and doing it all up, and then just sitting down at the table eating the whole thing, crying the whole time. It just made me really sad. And then Bill said, no, I didn't make a cake for myself. I'm a pie guy. So anyway, I'm a deputy sheriff. January 1st, 2022, I started my 40th year in law enforcement.
Way to go, man. Now that's cool.
There's much more, but I'm already boring you. That's true. Again,
right.
Thanks for all that you do. I'm here if you need anything. Keep warm this weekend. And then he said, please tell DJ Mel B thanks for the shout out at the end. That was sweet of you guys. So very good. So there's the thin blue line. At least he heard his shout out finally. So, all right, you guys ready to take some phone calls? Oh, wait, you had a story though, right? This is interesting. We've touched on this before. Go ahead, DNP Carissa. What do you got?
Do you want me to read this whole?
Well, just give us the sort of Reader's Digest. If you just want to hit the conclusion, talk about what it is and then hit the conclusion in the abstract, and then people can go look it up if they want to.
Sure, absolutely. So this is about a man who took a trip to the ICU after injecting mushrooms. Into his veins. So
terrible idea.
Obviously, he decided to do some research on his own to get over opioid addiction.
Okay.
And in his research came across how mushrooms would potentially help, so he decided
there's some good data on this
are.
in psychiatric use of psilocybin.
Yes, and he took psilocybin and made a tea with it. He boiled him down.
No, don't do that.
And he took the liquid and then injected it directly into his veins.
No, don't do that.
And a few days later, his family found him unresponsive, took him to the ER. He was hypotensive.
So he had low blood pressure.
Yes, low blood pressure.
So was he septic from it, or what happened?
He was septic.
Okay, septic means he had bacteria growing in his bloodstream, and then you get a thing called septic shock, which is where your blood pressure drops, and they have to put you on medication to keep your blood pumping. Go ahead. So it wasn't the psilocybin that did it. It was just injecting tea into his vein.
Right. And
Did he get off?
he had to.
I mean, did he say?
Well, for fuck's sake.
Well, I mean,
I think the question is not did he get off it, was he tripping? Was he tripping?
I have no idea if he was tripping. It doesn't say. He was not conscious to be able to let us know how he was feeling.
wow.
He was admitted to the ICU, the intensive care unit, for renal insufficiency, liver injury, multiple lab abnormalities. And on day 2, he was diagnosed with fungi growing in his blood.
There you go.
So the moral,
That makes sense.
right? The moral of the story was he attempted to use this psilocybin and melted it into a tea, injected it, and then the punny tag is he grew the mushrooms then in his blood.
Oh. That's a terrible joke. Poor bastard. Did he live, though?
Correct. He
Okay,
did.
so we can laugh
He did
about it
live,
then, but-
yes.
Yeah, so
he was on
he
antibiotics long term.
basically injected fungus into his bloodstream. I wonder, though, was it psilocybin fungus that was growing? Does it say what brand of
does.
fungus grew? What was it? It couldn't be psilocybin. It wouldn't grow in his bloodstream.
Psilocybe cubensis?
It was?
Yes.
Oh, my God. So,
An example, the
He only
species of
oh my-
mushrooms he had injected was now growing from his
oh,
blood.
my God. Oh, my God. I just assumed he injected skin fungi. Dude.
Correct.
Dude. He didn't even boil the water.
I guess he
There's
just
no way
put it
that-
in water.
Yeah, he just
And-
steeped it.
Oh, Lord.
Correct.
Oh, okay,
Terrible.
everybody, don't
Yeah,
do
don't
this.
do it.
Oh my God! Oh my God!
Correct.
He must have been tripping balls, though.
I
So they had to
mean-
kill this. So he was growing magic mushrooms in his bloodstream,
Correct.
and it was killing him. And I'll bet you he was tripping balls the whole time.
And one would think if your blood's growing magic mushrooms that you'd be tripping balls.
Can you believe?
That's crazy.
I mean, I've seen people get fungemia
Correct.
from doing dumb things like I've seen people that had catheters going into a port, and their dog bites the catheter, and instead of coming in to get the thing replaced, they just tape it up, and all the dog mouth organisms, including fungi, get into their bloodstream, and they end up almost dying from that. So that's bad. Oh my goodness.
Yes.
What? That's a good one.
So there's a little discussion. I can read it to you if you would like.
Well, is there anything more insane in there than what you've already said?
I don't believe so. The most important thing in that it talks about, though, is that there are...
Don't do that.
Don't do that. But there are also very positive uses correctly with
Yes.
the psilocybin. But
If you
yes,
listen,
and they don't know if he would have ongoing persistent psychoactive effects from
the
growing magic mushrooms in his blood.
Now,
Jeez,
just
oh,
the single cells may not produce the toxin or
The psilocybin,
The psilocybin. That's interesting because you may have to form that. Basically, a mushroom's the sex organ of a fungus, and the majority of it, my understanding is, lives underground. But so without being able to form that, can they form psilocybin? I don't know.
That's a good question.
I'd like to
That is
think
a
that
good
they could,
question.
so at least he got something out of it.
Yeah, or at least he was so stoned he wasn't in miserable pain.
Right.
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 Thinking he's
Yeah,
dying.
yeah. So, a couple of things here. People with opioid addiction can become very desperate for help. There is help out there. And if you don't know where to go and your primary care doesn't know where to go, or you don't want to talk to your primary care, go to samhsa.gov, and it's samsha.gov. And it's not right then, is it? Shit. That's SAMHSA, isn't it? SAMHSA. There it is. Okay. Substance Abuse and Mental Health Services. So samhsa.gov. You put in your address or your zip code, and it'll give you all kinds of stuff. So find a facility near you. Let's find one near us. I'm going to click on it. This is the other thing that Carl really likes. And here you go. You put in your zip code or your city. So I'm putting in
Somebody else's zip code.
yeah. And then here you go. And then there's like 20 of them just right near here. So, and then just start picking up the phone and call them.
You could stagger down the street here and get one.
Yeah.
We have so much of the prevalence is huge, unfortunately.
Yeah.
The need is huge.
But you're right. The need is huge, but we have more facilities now than we did.
Yeah,
and just about
Yes.
everywhere
Yeah,
has more than they did, which is
thankfully.
good. So, anyway, yeah, check that out. All right, thank you. That's a good one.
That's good.
Of
Hey,
course.
you want the worst news of the day, Dr. Steve? I just saw it.
She's so humble. Yeah,
She is. Worst news of the day. I just saw this. I was doing my show prep while y'all were talking.
yeah, of course. That's the best time to do it.
Hey, but I've got a great
During
story.
the show.
I've got a great story. The reason why I didn't do it is we rescued a puppy today.
Oh yeah.
Oh my God, she's beautiful too. Anyway,
What kind?
she's a little golden retriever.
Oh.
Her name is Sugar-Ree.
Sugary.
You already named her?
Yeah, she's my baby.
A horrible name.
Thank you very much. She goes with Stella Blue, of course. which
Oh,
is,
okay. I
There may
guess.
be a trend.
There's some hippie meaning there.
Yeah, something
Okay.
like that. Anyway, so New York Post: man's agonizing penis pain is found to be a rare side effect of COVID. Any guesses on what may have caused his penile pain? I know you know. I know you're going to come up with it.
Okay,
Well,
I have an idea.
You got because I've got an idea. You got an idea?
No.
I'm going to guess that he had clotting in his
Yeah.
corpus.
That's-
Did I got that right?
yeah.
Okay.
Give yourself a bill.
That's what I thought too.
Doing
I
it to
figured. I
myself.
figured he had blood clots, and that is actually.
Yeah,
what
read it.
was, yeah.
Read it.
Yeah. So
New York Post, that wonderful medical journal.
it's the best I could do in a
No,
crunch.
no.
Dr.
That's a good one. That's a good one.
But even if it's inaccurate, at least it's real. The blood clots are real.
Yeah,
Very
yeah.
real. Yeah. So it looks like a young man, 41-year-old, was having sex, had never had any trauma or any pain associated with erection. Started having serious pain during the encounter, and
So he must have been post-COVID, or he was one
say post-COVID.
horny son of a bitch. Because
Post-COVID.
when I had COVID, the last thing I was thinking about was getting my rocks off.
Yeah, but it might have helped lower your fever.
No, but that'd be a good excuse.
Exactly. Yes.
So anyway, he's
trying to help you, Dr. Steve.
He's over COVID.
Yep. Yep.
And we know that some of the adverse effects can happen. And how old is he?
41.
Okay, so he's relatively young.
Yep.
Okay, and then so he starts having pain.
Yeah. So in 2 days later, goes to the urologist, and that's when they
Did he have priapism? Did it say?
as running. I'm getting towards the end of this.
Because when you get a clot in your corpora cavernosa, those are the the big spongy, you've got the
cells,
spongy areas in the penis. There's corpora cavernosa, corpora spongiosum. And when you get clots in there, you can get priapism, you can get all kinds of stuff. And so if you have an erection that will not go away, that is a medical emergency. 4 hours, you need to go to the emergency room. Or your penis can be permanently damaged. So what does it say?
So it said it did resolve itself, and he had ultrasound showed no blood flow to the vein. So what? So while I guess they wound up doing an ultrasound. Once he got to the urologist, that no blood flow past that clot. And that's when they put him on the blood thinners, and now happy to report no pain and everything is fine down there in working order, as he says. Everything's in working order.
Thank goodness.
Thank goodness.
Yeah.
Can you imagine?
Well, if that's not enough to get your attention on this being a real disease.
Correct.
Well, it's like I was telling somebody the other day, and they laughed about it because he was outside smoking, and we were talking about quitting. And I said, I used to smoke 3 packs a day, but I haven't smoked any since like 1999, 2000, somewhere in there. And they said, how'd you quit? And I said, well, it sure wasn't the heart disease. That didn't scare me, and cancer didn't scare me. But when I found out that the number one cause of reversible impotence in men over 40 is tobacco abuse, I laid them down right away, and it made it easy. So it is funny. It's how the other stuff just doesn't scare you, but that scares the shit out of you.
We're boys. The reason I quit dipping Copenhagen is because I was having facial pain. I thought, God, what happens if I get cancer in my jaw, and I can't have a pretty girlfriend. I mean,
Yeah.
it's not the cancer killing me, or
Right.
it's not
Right,
being
because they take off half
we
your
get a pretty girl.
face.
Yeah, that's insane.
I ever tell you the story about my ENT professor and showing us the pictures of them taking half of people's faces off for head and neck cancer?
Oh yeah.
I did tell you this. I've told this on this show. Well,
Maybe not. Maybe not. Dr.
So this guy, his name was Newton Fisher. He was very eccentric, and it was at the University of North Carolina, Chapel Hill. And there was this guy in our class. I'm just going to call him SD. I'm not going to say his name because he's in practice. And SD was one of these guys. He and I studied together, so we were kind of friends, I guess. But other people in my class could not stand him because he was kind of a what's the word? He was difficult to be around, and he was a little bit of a brown noser. He liked being the center of attention. He was very smart, and I just remember one time there was this guy. We'll just call him Tony, who SD and I were down in the lab talking, and Tony comes down, and we were fourth-year medical students at this point, just fourth-year medical students. And Tony comes down with these 2 vials of blood, because we had to draw them back then. And SD looks at him and goes, "Hey, Tony, why don't you let some third year do that?" And the way he said third year was just like, some pond scum. Now, we were 2 months into our 4th year, so he was a third year 2 months ago, and he's already shitting on people under him. What he didn't realize is that Tony wasn't in our class anymore. He got held back, so he was a third year, so it made it even worse. So he's just, kind of an asshole. Well, anyway, okay, so
I don't think there's a kind of there.
that sort of just sets the scene. So we're in this lecture about head and neck cancer, and Newton Fisher keeps showing us one picture after another of people with half of their face that has been dissected away for head and neck cancer. And so there's no cheeks, there's no lips on that side. You just see teeth, and you see turbinates, the other side of the nasal septum. And they look like, they look scary. And we were like, holy shit. And Newton Fisher would yell at us. Let me see if I can do this right, if I can do it right. And he would yell at us and point at us from afar and go, "If you miss this diagnosis, I will despise you." And we were like shaking in our boots. Well, there's 4, we were in this large lecture hall, and there's 4 empty rows with all of us. And I was in the back with my best friend Ty and Jim. And here's SD in the very front row looking up at Newton Fisher, right? So it's by himself, very front row. And then Newton Fisher would yell, he'd show us another picture. "If you miss this diagnosis, I will despise you." And again, shaking in our boots. And then all of a sudden, he just stops in the middle of his lecture, and he looks down at SD, and he says, "Your beatific smile is insipid, sir." And we all just about shit our pants. It's the greatest cut I've ever heard anybody. "Your beatific smile is insipid, sir." It was so great. We loved Newton.
That is hilarious.
And
wouldn't have known what it meant, but I still would have been hilarious.
Yeah, you would have known. Well, you know what beatific is, right? It's like you're a saint, like
nobody's ever called me beatific anything.
Right.
Me either.
And insipid. Well, you know what insipid means? It's just completely tasteless. It's a diabetes insipidus.
Right.
Means you're pissing out water that has no flavor.
Right.
Well, it has
no sugar in it.
Goes way back to when people used to taste urine.
Yep.
That's why they invented dipsticks, by the way. Some doctor invented dipsticks so they didn't have to taste people's piss anymore.
That's
but
good.
anyway, yeah. So, I mean, if you have to explain, it's not nearly as funny, but, it was just such a great day. And we still, so I went on this guy's health grades. There's this health grades, and I put that on there. And so when I tell this to my medical students, just to relate with them because it's a medical school story, and they can relate to what they call goners, people who are, work a little bit too hard at the expense of their brethren. And then I said, let's go to his health grades, and I pull it up, and it says, your beatific smile is insipid, sir. It's just a good coda to the story. But anyway, yeah, Newton Fisher had about 9 kids. He was very, very eccentric. At least anyway, it was a great program. They invented the surgery that PA John had. Did you know that, Dr. Scott? Well, PA John had a stapes. Where the remobilization because he had God, now I can't think of the name of it. Otosclerosis.
Yeah, because they'd frozen together.
Where the 3 bones in your middle ear, the tiny little bones. I mean, they're this tiny, millimeters. They're supposed to move together to transmit air or vibration from the eardrum to the inner ear, and his were just frozen over, and they went in and remobilized them. So
I forgot about that.
Yeah. All right.
Yeah.
Okie doke. We were going to take some medical questions. What do we have? 8 minutes left. But anyway, here we go.
Hey, Dr. Steve. It's Albert from Albuquerque. How you doing?
Hey, Al. How are you?
Great.
Good.
Hey, listen, just calling back on kind of an ongoing saga. I called in before about some astronomical levels of testosterone that turned out to be, not free testosterone, but total, affected by a sex hormone.
Okay.
And changing PSA levels, so I'm seeing urologists and doing some other diagnostics. One of the things they just had me do, to my pleasure or displeasure, is last week I did have a prostate biopsy.
Okay.
And to those people who don't know what that entails, it's pretty interesting. They put you in some stirrups and you show the world what you got, what you don't got, and
mostly what you don't got in my case.
Lidocaine to numb you up, supposedly. When they hit that pelvic floor, man, that was interesting.
Yeah.
Then they go in with the needles and they shoot the shit out.
He's 100% right. They do that to make them feel better, not to make us feel better. Scott and I can relate to this.
Out of the prostate, taking chunks of prostate out, I guess, to stir into soup or something. I don't know. Anyway, the dude,
pretty much.
In any event, that all was good and fine and uncomfortable, but, totally worth every minute of it if it's preventative of anything.
Yeah, of course.
But my question is, and I think you might answer this with somebody else, but it took me back, is they said there's blood in the urine for a couple of weeks.
Yes.
6 to 8 weeks potentially. Mm-hmm. And I was expecting a little blood in my urine. I've had kidney damage before where I've gotten shots in the kidney and I've peed blood for a couple of days, and that was taint. It's a little bit of a taint. This, I'm shooting blood clots out of the dick. You know what I mean? It's a plop, plop, plop. They're hitting the water like 3 in one shot one time.
Nice.
And then I had the brilliant idea, maybe I need to clean out some other tubes. So I did your favorite thing. Go ahead, play it. Yep, I did that, fully ejaculated. It was comfortable and enjoyable and holy shit horrific when nothing but blood seemed to come out of the end of my dick.
Yeah.
So anyways, took me back a little bit, but, they...
Okay, I know what he's going to ask. How can it be that he's still bleeding this long? And the thing is, he's not. What's happening is when they did the biopsy, there is bleeding, but it kind of just works its way through the prostate, right? And all of those little tubes and all that stuff, and when you urinate, some of those things will cut loose, and you'll express some of them. It only takes a few drops of blood to make a blood clot. It only makes a few drops of blood to make semen completely blood red. So what you're really doing is just emptying out that sponge, which prostate's kind of spongy. That sponge of all the blood that collected when they did the procedure. That's basically it. And there may have been some bleeding afterward, obviously. And if it congested your prostate out a little bit, then you've just got that much more that you got to clear. But that's what's going on. All right?
Yeah.
Questions, comments? All right, because I want to get this question in. And then we've got, let's do this one. There's 2 about COVID that I do want to cover.
This is the guy who posted a video from Dr. John Campbell where he was quoting some COVID death without any pre-existing conditions. This is for England and Wales.
Yeah.
Those numbers were derived from actual death certificates.
Right. So what he's referring to is there was a study that showed that there was I think 15% of people who died didn't have any pre-existing conditions, and this was in New Zealand or Australia, somewhere like that. I don't remember the exact study. But I asked him where did they get the data from, and indeed it was from death certificates. So let me tell you something. Doctors don't know how to fill out death certificates. So when you see this thing from the CDC where they say, well, 6% of people had COVID as their primary diagnosis, and people go, oh, see, so 94% of people died with COVID but not from COVID. It's like, no, they don't know how to fill the death certificate out. So those 6% that said patient died of COVID-19, those are the ones that are filled out incorrectly. Because what do you, Carissa, you see lots of people with COVID. What do they die from when they have COVID-19? Number one thing.
Failure.
Thank you. Okay.
Give yourself a bill.
So that's one of them. So the proper way to fill out the death certificate would be respiratory failure due to, or as approximately caused by, or however they word it, depending on the state you're in, by viral pneumonia caused by COVID-19. That's a properly filled out death certificate. If you just put COVID-19 at the top and turn it in, they'll accept it. And it'll go into the record as someone who had COVID-19 with no comorbidities, nothing, they just COVID-19, but that is not scientific. And what it really reflects is just piss poor death certificate filling out of skills. A terrible sentence, but you know what I mean. All right? Okay, and then I'm going to get this one, too, because this one drove me crazy in the news this week.
Hey, Dr. Steve, and whoever else is in there with you.
Thanks.
So I sent you an email
with
a screenshot of a tweet about the FDA banning use of certain monoclonal antibodies.
Yes.
And it turns out that some of them
you're stealing my thunder,
against,
dude. What the ones that were sent to me was, hey, did you see this? And it was Florida says they can't give antibodies because the FDA is taking them away from them or something like that. I mean, that was what they were implying, was that somehow someone was conspiring to keep monoclonal antibodies out of the hands of people that needed it. And if you saw it spun that way, it was incorrect. This is what really happened was, with Omicron now being 95 to 99% of cases, Regencov, which was the one I got for Delta, I had Delta, Regencov and the other one, I can't remember the other one's name, they don't work anymore. Now, can you imagine, though, being Regeneron, and it's like you've got this wildly successful treatment to keep people out of the hospital? It was wildly successful for me. Mm-hmm. I had it, and the next day I was completely normal, didn't miss a day of work. I had to work telehealth because I was in isolation, but I didn't miss a day of work. And then one day, this new variant comes, and your stuff is just shit. It's worthless. That would be maddening to me as a researcher. But anyway, so that's what happened was that though Regencov and the other one, again, can't remember the name of it right now, were authorized under one of those emergency use authorizations. Well, once they didn't work anymore, the FDA just revoked it. That's all it was. We still have sotrovimab. Sotrovimab is a monoclonal antibody, just like Regencov, except it is effective against Omicron. The problem is they weren't expecting this. It's like they were sort of third competing against Regeneron and the other company, Eli Lilly. And all of a sudden they're thrust into the forefront, and they weren't ready. They were caught with their proverbial pants down. So now they're going to have to ramp up, and I know they're leery about ramping up because they're like, well, what happens if there's another variant that now we are worthless. So they don't want to spend a lot of money on it, but they kind of need to because there's a huge demand for it. So it's a little bit of an interesting situation. So that's what happened. And the emergency use was just withdrawn, not for any nefarious purpose, but just simply because the stuff doesn't work anymore. All right. There you go. Now I'll let him finish his question, see if he had anything in there.
Omicron, I guess. Is that what we're seeing here? So seems logical that they banned it, I guess.
Yeah.
Because it doesn't work for this variant.
Yeah, see, I wanted to be the genius, and he answered his own question. All right. We have one quickie, I think, that we can do.
Well, hello, Dr. Steve
Hello.
and crew. How is your New Year's?
Delightful.
I hope it is well.
Oh, Naya Sal Mubarak
Anyway,
to our Hindi friends.
I have another stupid COVID question.
No such thing.
So I have a cousin that works as an RN in Spokane, Washington, emergency room at a hospital.
Yeah.
And I also have an aunt who works as I think she's an aide or something, but she works in the emergency as well.
Okay. I'm going to answer this one real quick. I know what he's going to ask because I listened to this before. He had AstraZeneca and wants to know if you can take the Moderna. And there was actually an Oxford study that said that you get pretty good immunity if you had AstraZeneca and then you take Moderna as a booster. Check with your healthcare provider before you do anything like that. But the data looks decent on that one, and that's particularly if you can't get the second or third AstraZeneca. All right? Hey, until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Chris, and thanks, Scott.
Thank you.
Okay. Don't go away because we're gonna answer real questions.
Oh, fun.
We'll just do the intro for the podcast real quick because we had to run. I ran out of time. I hate that I didn't get to give those guys the time they deserved. Okay.
Do you ever talk about like weird history medicine?
Yeah, you want to? You got something? We'll talk about it in the podcast side. You in it? Yeah, you got something?
Maybe.
Okay.
What do you call a cat who drives a taxi? A tabby cabby.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve, take a scalpel.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And also in the studio, we have DNP Carissa. Hello, Carissa. How are you today?
Hello, Dr. Steve.
I have somebody
I'm good.
calling me, and we won't be talking to them right now. That was Dan McCabe, by the way, our buddy Dan McCabe, who's been on the show before.
Yeah.
All right. Anyway, now he's got me all messed up. Thanks a lot, Dan. This is a show for people who never listened to a radio show about medicine on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347
Poohhead.
Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right. Don't forget to check out stuff.drsteve.com. That's stuff.drsteve.com, where you can buy all kinds of cool crap. And you can just scroll down and see all the stuff we talk about on the show, or you can click through to Amazon. And when you do that, it really helps keep us on the air. Check out Dr. Scott's website at simplyherbals.net. And we'll talk more about what you've got planned for that in a second, Dr. Scott. And please check out our Patreon. Patreon.com/weirdmedicine. It's Tacey and I are doing that together. For those who miss Tacey, and we're also going to have some celebrity guests and some live streams and other stuff over there that you will only be able to get at patreon.com/weirdmedicine. All right. Okay, now let's go. Now, one thing we could do is maybe take those last two calls and amplify on those, and that way I don't have to cut them off so quickly. So one was about, I did the one about death certificates, right? But let me see. Let's see. Okay, wait a minute. I think No, I let him finish his question. Okay. And we will start here. Okay. So I said one quickie we can do. And it is on, I can't remember. Oh, yeah, it's this one. Sorry. Okay, here we go. Well, are you going to say something? It's on that party line.
Well, hello, Dr.
Oh,
Steve.
well,
and
hello.
crew.
Hello, my friend.
How is your New Year's?
Good. How about you?
I hope it is well.
Thank you.
Anyways, hey, I have another stupid COVID question.
No such thing.
So I have a cousin that works as an RN in Spokane, Washington, emergency room at a hospital. And I also have an aunt who works as I think she's an aide or something, but she works in the emergency as well.
Okay.
They are both seeing more vaccinated cases than unvaccinated.
Yep.
And I'm wondering if I think you've mentioned before that you are in and out of the hospital as well.
Sure.
These days. So can you, are you seeing the same thing at your hospital? And why? And also, by the way, they were seeing this before Omicron, but that's beside the point. But are you seeing this as well? And also, why is this considered misinformation, if you know the answer to that?
Well, I don't think it is considered misinformation. We're seeing lots and lots of cases, breakthrough cases of, the vaccine doesn't seem to be preventing people from getting COVID like we hoped it would in the beginning, and certainly as it was sold to us. But what we are seeing is, let's just ask DNP Carissa, how many of your patients who are on the ventilator right now have been vaccinated? A percentage.
I mean, less.
Do you know of any?
No, I was going to say less
you
than
can say
one.
zero.
I mean, I don't know of any personally.
I have not seen one on the ventilator that's been vaccinated in quite some time. And when I say quite some time, I'm talking months and months. Correct. Now, I think we had one, and that person was 85 and had cancer or something, and they had been vaccinated, and they just didn't do well. Mm-hmm. But, they had multiple comorbidities. So I don't think that's misinformation. If I get thrown off of the air or off YouTube for saying that we're having lots of breakthrough cases, so be it. That's the truth. We are. Yeah. And some of them are showing up at the hospital we've even had some being admitted. We've got some right now that are being admitted. It's like, why are they admitting them?
Yeah.
I walk in and they're fine. It's just that they feel like they're at risk because they're elderly or whatever, and then they're getting discharged in a day or two. So we're admitting a lot more people. In the beginning of this thing, we were so afraid of the hospitals filling up with nothing but COVID patients, they were sending people home who actually had low blood oxygen. Just giving them a prescription for oxygen, saying, hey, call us if you get worse. So that part, it seems to have changed. They seem to be admitting those people now. Is that your experience as well?
Yeah, I've seen a lot of COVID patients that are rather healthy. I mean,
right.
We're just kind of watching.
And just sitting
watching
there.
them.
Yeah.
And I did remember one, and it's also been months ago, and the patient was vaccinated but had only had the first dose.
Yeah, okay.
And also had metastatic cancer and multiple comorbidities.
Yeah.
So,
yeah, that seems to be the truth of it. Is multiple comorbidities are, that increases your risk. Although even if you're 85, I mean, in the beginning with OG COVID, the death rate, if they were admitted, was something like 20%. But that means 80% did just fine. It's still 20% is a big number.
Massive number, yeah.
But anyway, what we're seeing now is the reason we're having this surge. If you go to covid.stoutlabs.com, I wish this was a more of a video show. Maybe if we put something like this up on our YouTube channel, I'll add some of these graphics. But if you look at the number of cases that we're having right now, we need to stop reporting cases because, there are record numbers of cases, but we need to be looking at deaths. So if we go at covid.stoutlabs, stoutlabs.com, and then just select the United States because that's what we're interested in, right? I mean, and look at new cases and add. The cool thing is that you can add a simple moving average. You can add Bollinger Bands, and if you look at it right now, you can see that it looks like we peaked on January 20th, which was 6 days ago. And as long as this thing follows the same sort of curve that the others did, which was a very symmetrical sort of Gaussian curve, and I'm looking at 750 days of this, and you can see the first peak was around July 23rd of 2020, and then the next peak was December 23rd of 2020. Then we had another peak on September 7th, which is the day I got it, by the way, of 2021. And now we've got this massive peak. This is the biggest peak we've had in cases. And it's already, so it looks like it peaked on the 20th. And so we're recording this on the 26th. So if this holds and it does a Gaussian curve, we should see, tell me this, how many days from now is December 5th? Because that's when it should return back to baseline if this thing follows a Gaussian curve. So December 5th to January 5th. So in 7 weeks? That would be the prediction based on this website, that in 7 weeks, if this follows the same morphology that the other curves did, that we'll see us back to normal again. Now let's look at new deaths. So that's, and I may go ahead and put this on. New deaths has creeped up some. It was absolutely flat, and it is starting to creep up slightly, but it is not even close to the point that it was in January of 2021, which was right after the peak of cases at Christmas, and it's right around, but lower than the peak from 9/27/21, which was the peak in deaths because of Delta. So very interesting. So this is, if you look comparatively speaking, the number of cases to the number of deaths, the ratio is much greater with this one, which is good. That means it's good. That means it's way fewer people on a proportionate scale are dying from it. It's just that the numbers are going up because of the huge numbers of cases that we have. But deaths and hospitalizations should be what we're looking at, not cases. Anyway, all right. We have, let's see here. Did I do? Yeah. I had one where the person asked about whether there was any benefit to getting a Moderna booster if they had AstraZeneca, and I meant to get somehow I erased over that question. And there was one study out of Oxford that said indeed that actually provided pretty good immunity, and that they were recommending it if you couldn't get the third dose of AstraZeneca or whatever they're recommending now. So if that's all you've got, that's totally fine to do, but talk to your healthcare provider. Don't take my advice on that. I'm just going by the Oxford study. All right. We have our buddy Cardiff Electric created a new theme song for himself, and since we're from the Cardiff Electric Studios, well, he's our boss. We need to play this for him. So.
Cardiff Electric, the most famous podcast in the world today. Cardiff Electric, he's so cool. Come out and play. He's the guy all the other guys are jealous of. 'Cause he's the guy that all the girls wanna be with. Cardiff Electric, the most famous podcast in the world today. He's got great guests on his show, like Dr. Steve and some other people. We love you, Cardiff.
We love you, Cardiff.
Love it.
Uh-oh.
Love it.
All right. Thanks, buddy. All right. We did titanium allergy last time. We had one from Peppermint Patty, and it's a two-parter, so I thought we'd play the first part and then the second part, and then we'll probably get out of here at some point. Okay.
Hi, Dr. Steve.
You doing
It's
okay on
Peppermint
time?
Patty. I'm calling you with something I hope you can give me some direction on, as none of the doctors over
When do you need to leave? It's 5:25. You okay?
Yeah, about 5:30.
Okay. Yeah, this should
the
just...
years have been able to figure this out. A little background. It started in my mid to late 20s where the left side under my eye would swell. I would get horrendous headaches. The fatigue would be so overwhelming. The smallest tasks would be nearly impossible. Over the years, I'd get it maybe once or twice, maybe 3 times a year.
Uh-huh.
Over the last 10 years, I've had it, maybe 3 or 4 times a year. The last 5 years, I've had kind of a little bit of constant swelling on the left side under my butt. It has progressed to where there's swelling under both my eyes, going down into my cheek.
I know what she has. Do you know what it is? Happens a couple or 3 times a year. It's accompanied by swelling under her eyes, and she gets a horrendous headache.
Both eyes, or just one?
Well, now it's both, but at first it was just one.
Well, yeah, when she first thought, I was thinking shingles initially.
No.
Nope.
I'm going to give you
Both
a no on that one.
Hashimoto's?
I don't think so. I think it's cluster headaches. And the reason why I say that is it just happens a few times a year, and that's usually associated with histamine release. So you'll get facial sweating, or you can get nasal congestion. You can get drooping of the eyelids, but you can get eye watering too. And when you get the watering of the eyes, and it also says eyelid swelling or edema either above or below the eyes. So I think that's what it is.
Did she say how she treated it? Because I mean, if it's just the O2.
Over my eyelids.
It's got to be what it is.
Yeah.
It's cluster headaches. Patty, if they didn't diagnose you with that, give us a call. Now she had another part 2 to this. I'm just going to play it real quick.
Dr. Steve, it's Peppermint Patty again. I just wanted to call and add a couple things that hopefully will be helpful to you in helping me figure out what to do and where to go with all this mutant eye disease. Normally, when I would get these mutant eye disease attacks, they would treat them with a Z-Pak, prednisone, and antibiotics.
The prednisone might
During
help.
the years these were happening, I also had advanced Graves' disease, radiation, and thyroid storm. there was one incident where I woke up one morning and I had swelling and the whites of my eyes were almost neon red.
Neon red would be a subconjunctival hemorrhage where you bleed under the conjunctiva, but that's interesting. I'm still going to go with cluster headache for the original thing, but her thyroid, she needs to see an ophthalmologist to measure the protrusion of her eye from the socket. And we have a friend who's been in the studio with us, and I'm not going to say his name, but he played with Super Android 23, who has Graves' disease, and that can make your eyeballs bloop out. That there was this one guy on the only reason I know this because my wife watches it. From 90 Day Fiance, and I think it was on the other way, and he got diagnosed from people seeing him on that show and saying, why did his eyeballs look like that? And somebody said, dude, you've got Graves' disease, and indeed he did. Wow. So she needs to get that checked too. But I'd see a neurologist for cluster headaches and then get your eyeballs checked to make sure that you don't have what we call exophthalmos.
Exophthalmos. And those cluster headaches are pretty treatable.
Yeah, they are.
Pretty easily.
They're a pain in the ass.
Hello, Dr.
Yeah, they're terrible.
Steve.
Yeah.
Well, this is our boss.
How are you?
Fine, thanks. How are you, my friend?
I know we're playing this again.
I'm great.
No.
Thank you for asking. I have a medical question for you.
Okay. Yep. Happy to answer any questions.
I am looking for a set of forceps to use for recreational purposes.
Excellent.
Can you recommend a good brand or model for me?
I think going to Amazon is the place for you're looking for.
I will mute my radio.
Thank you.
And listen to the answer.
Thank you, my friend. Mosquito forceps is what you're looking for. If what you're looking for is something to hold, let's say a rolled up piece of paper that you might hold up to your mouth, something like that, you're looking for mosquito forceps, you can buy those at Amazon. All right. No particular brand.
Or your local head shop.
Yeah, or your local head shop. Exactly right. All right. Thank you, everyone. Do we have any questions for you? Don't have time to answer any questions from the waiting room, do you?
No, but I asked him before we started the podcast. Nothing new.
Okay.
Nothing new yet.
We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia. Thank you for coming. Caressa, did you have fun?
Of course.
Yeah. Try not to talk so much next time, though. Okay.
Right.
No, but I'm telling you. You brought you and Lydia are in competition for the greatest story ever brought into this studio, and it's just been in the last year. Lydia had a guy who had a tapeworm, and the tapeworm had cancer, and he got metastatic cancer from the tapeworm. So he had cancer cells in his face or something, and when they typed them, they weren't human; they were tapeworm cells, tapeworm cancer cells. So that and the growing magic mushrooms in your bloodstream, I think, are the two best medical stories from the literature that we've ever had in here. So thank you.
Of course. Thank
you. You can come back anytime. And in 3 weeks, as a matter of fact. So we can't forget Jim Norton, Travis Teff, that Gould Girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Eric Nagel, the Port Charlotte Horror DJ, Jazzy C, the Saratoga Skank, the Florida Floozy, Roland Campos, sister of Chris, Sam Roberts, she who owns pigs and snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double, a.k.a. Steve Tucci, one of the greatest guitar players, and PM&R physicians that ever lived. Great Rob Bartlett, Vicks Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, the inimitable Vincent Paulino, everybody. Producer Chris, Eric Zane, I almost doxed him. Bernie and Sid, Martha from Arkansas's daughter, Andy the Trucker, Ron Bennington, and of course our dear departed friends, Fez Watley and G-Back, who supported this show. It never went unappreciated. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts, other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for for the next edition of Weird Medicine. Thanks, everybody.
Thank you, guys.
Thank you.
Get out of here, Scott.
Yeah, I apologize. I'm headed to Boca Raton.
Yeah, right on.
Hopefully for some sunshine.
All right.
Yeah, I'd hate to be rude.
No, no, you're fine.
That's all good. Chris is wonderful show. Thank you.
Oh,
Yeah.
glad to be
Yeah,
here.
really, we do appreciate you.
You made history today, even if you didn't talk that much.
I didn't have a lot to say.
That's okay. You just jump in next time. That's totally fine. You can, anytime.
All right.
Are you leaving? You gonna go say hi to fucking Perry?
Fucking Perry.
Hey, Shannon was in there.
Yeah. I saw a
What?
couple. There was a couple good ones in there.
There's old Shannon Wallen. He sure is a good. This guy was in Troma films, and he always plays like a red Shannon.
Yeah.
Were you not here?
Yeah.
Oh, I think he took your place one time when you weren't going to be here. But anyway, he
I may not have been.
I can't remember.
I may not have been.
But he plays he always plays demented redneck cannibal or something like that. Hey, Shannon.
Right.
There's Lovett. Thank you, Lovett. You're a good.
We told Lovett thank yous.
Yeah, we got to come up with a radio name for you. It's too hard to say DNP Carissa.
Yeah.
It really is.
I think
It
Super
is-
C.
Super C.
Or Vitamin C.
Vitamin C. Oh, there
I
you
like
go.
Vitamin C. I like Vitamin C.
We'll call you VC.
See ya.
All right. Okay. See you, man. Have a safe trip.
Yeah, we'll do. Yeah.
Are you going to hit up the dispensary while you're down there?
I may take my own.
Well, yeah, all right. Oh, no, don't take your own. That's stupid.
I'll be back soon. I'll see you next week.
Okay. All right. Hey, thanks, everybody. I'm going to shut it down. Have a great week. We'll see you next time.
Motion